also regret that you came because the issue of mental illness needs attention at this time more than any other time in our nation life. Everything that precipitates and will lead to mental illness is in our country, not just in our country, they are even on the rise. They are rising every day. Whatever you can talk about that can precipitate mental illness, we have it here in large dose. There is the insecurity in our country right now. The side effect of that insecurity, we are yet to be able to fully capture and know how many years it will take us to overcome it. One of the things we look at that makes us afraid most times when the issue of mental illness wants to kickstart is when people stop sleeping. When people stop sleeping, in fact, for those who are having one form of mental illness or the other, when they recover, one of the signs you look at when they want to have relapse, that they stop sleeping, they'll just be talking in the morning, in the night, they're not sleeping. Now, when people don't sleep, it's a big challenge. And right now in Nigeria, I can tell you, people are no longer sleeping. Especially in the northern part of the country, people are awake every day, they are afraid of anything can happen, they want to save their life, and so because of that, very few people are sleeping. I've spoken to some few experts from the northeast of Nigeria and some other parts of the country, and they tell us that they cannot cope. In fact, they themselves are about breaking down because they cannot cope with the number of people that are breaking down every day, and those who are going through one form of traumatic disorders or the other. That is in that part of the country. In this part of the country, you talk about youth that are using drugs. You talk about also different forms of common mental illness among us, that those common mental illness are illnesses that allow us to still go to school, to still go to work. We work, but only that we are not effective on our work. We are not delivering. We are not meeting up with deadlines. We are not being as productive as we should be because we are having one form of common mental disorder or the other. And those ones do not stop us from dressing well. They do not stop us from doing so many things that we do naturally, except that within you, you know that you are not performing at your optimal. There are a lot of it among us too, which I'm sure today, as we go through the lectures, we'll be considering a lot of them. This project we're having here, as we see, is Youth Empowerment Support for Mental Health, and that's why we call it Yes for Mental Health. We are bringing together the youths of our country to say yes for mental health. We choose to be healthy, we choose to be alive, we choose to be productive, we choose to restructure and to reshape this country. Because right now, it's like the way Nigeria is going, it will take me and you to be able to save the future of this country. And so that's why we're here today. We have different lectures. We also have a panel discussion. I'm thinking that the panel discussion is going to be one of the best time here because that is when you get to be able to ask any question you want to ask on the issues of mental illness, and the experts that will be sitting on the panel will be able to give you answers. So it's going to be a very, very interesting moment here in the next few hours. We're not going to waste time at all because already we are over 2 hours behind, and we need to also finish at the right time. So I want you to please be awake. We have some water and some very slight refreshment we'll give to you so that you keep awake and keep enjoying the lectures. I just want to say thank you. I don't want to waste your time. Mental Health Foundation, our vision at the Mental Health Foundation is to build a nation in which mental illness is not enshrouded in mysteries, in discrimination and stigma. Now, what is making mental illness to have so much challenge today and high level of stigma is still because of the mysteries around it. There's so much mysteries about it. People don't know exactly what it means. People have different perceptions, different understanding. But I'm sure that by the time you finish from this place today, you have a better knowledge of mental illness as well as mental health. And just like the two people that left here said, Our goal is to promote mental health, prevent mental illness, and reduce stigma. That's our goal. As we talk to you, as we create awareness, we promote mental health. That is what everybody needs. Everybody needs mental health. Everybody needs mental health. You need to be able to discover your potential. You need to be able to relate very well with people around you. You need to be able to cope with normal stress of life, and you need to be productive and be able to contribute to your community. Everybody needs that. And that's what we want to promote here, mental health. Prevent mental illness and reduce stigma. As you listen, I'm very sure by the time we finish, you will not remain the same. I want to say thank you. Also, in rounding up, we want to use this opportunity to raise mental health advocates, mental health ambassadors. So we'll be glad if some of us, if not everyone here today, will want to join us to become a mental health advocate so that together we can save our youth. Should I give you the statistics that in Nigeria today we don't have up to 100 active psychologists. We don't have more than 150 psychiatrists active that are working in the country. The psychiatric hospitals, maybe about 8, and then some department of psychiatry is on teaching hospital. It is not enough. I don't think we have up to 5,000 beds all over the country. All over the country. The biggest of the hospital, I think, is Yaba and Ushodi, and it's now up to 600 beds. So there is no even bed to keep people. So we want to do everything possible to make sure that the number of youths that are breaking down every day will save them. Right now at the hospital, most people are just being given first aid treatment and they are asked to go back home because there is no bed to admit anybody. So you now see why we need a lot of mental health advocates. We don't have the expertise, we don't have the infrastructure, we also do not have the resources because the budget on health, what is given to mental health is too small. So there are so many things that is against us, and yet every indices that leads to mental illness is on the increase in our country. So you see why we are here so passionately. And I believe that God has brought you here because you are the one that God wants to be here, because you are the one who can be the advocate that we are looking for. Thank you for coming. God bless you.